Well, I won't give a disclaimer or anything.
Oh,
No, we won't say anything good.
okay. You can say bad things. No, I'm just kidding. All right, let me just double check that we are actually.
You're not in your office today, Dr. Saunders.
Well, I'm right next to my office.
Okay.
I was talking with somebody yesterday, and just being, and she said, it's such a nice day. It's too bad you have to spend all day inside. I'm like, yeah, that is too bad, isn't it? So, springtime, it's great.
After work yesterday, well, I'm in South Florida, so it's warm, but I got out a hammock and I was reading a book outside in the hammock after work yesterday, trying to get in some, relaxing outdoor time. And it's wonderful.
Yeah.
Hey, all right, we're good to go. So the benefit to you guys is this is being recorded. So if you have to get up and go do something, you can come back and watch the replay. Or if you have a friend who you think should really check this out, please send this to them. I will actually post the YouTube link in the chat so that you can send that to whoever may want to see it. In fact, share it on your Facebook page. That'd probably be a really good idea, or Instagram. Post it there because there's a lot of really good information in these webinars that can be difficult to find in other places. And I think that the people that you love and care about would really benefit from that. So, okay, let's go ahead and do this. Let's start. First of all, Dr. Saunders, wonderful doctor, of course, but he is not your doctor. So please consult with your healthcare provider before you implement any of the things that we talk about today. And actually, what we're going to be talking about today is phase one. Uh, we talk about the diabetes solution kit a lot in on this webinar, and I usually have it sitting right here. Found it. Here we go. Diabetes solution kit. This is our, what would you say? This is our recommendation to reverse type 2 diabetes, right? And is this the only way to do it? No, but I think it's probably the most simple way to do it, honestly. I really do. And the cheapest. But if you go
Nope,
to
there's
Dr.
a cheaper
Saunders'
way.
office, would you say?
There's a cheaper way.
Yeah, that's true.
If you just
That's
don't eat,
true.
you don't have to
Wait,
buy
I
any
think that's
food.
in here though. So
It is.
anyway, we're talking about phase one in this webinar today, but we're also going to be talking about measuring your ketones. And this is something that we have not, I know that Dr. Saunders has a lot of experience with this. Some of you do who are watching the webinar as well, but it's not something that we've talked a lot about. We don't include that in the diabetes solution kit. It's just what would you say? Another way to really dial in and see where your body is at in order to get healthy, or what do you think is the importance of measuring your ketones?
I've run into this a lot lately of people who have saying, I'm doing what you said. I'm following the book exactly what you said, and I'm not getting better. And or I've reached a plateau and it's just not working well for me. And so then I asked them, "Are you measuring ketones?" And they said, "No, that's not part of the book." And I know it's not because we didn't want to complicate things with uh, having to measure it. And most people do really well with just cutting out the carbs and continuing exercising. But that doesn't work for everyone. So the importance of measuring ketones is to know. It's to know where you are, where you stand, what you're doing. Because if you are not making ketones, then you're not burning fat for energy. That's the key right there. And you want to be able to burn fat for energy. So I've had a lot of people with doing a lot better. Their insulin resistance is better, but their blood sugar is still high. It's still, like averaging 120. Hemoglobin A1C is still 5.8, 6.0. And it's not diabetic, it's pre-diabetic, but it's not come down to normal. And they're like, why not? And so the next step is to say, oh, are you burning fat for energy? Because some people, for example, burn uh, uh, protein. It's a glutamine, which is one of the amino acids, and they're using protein to make new glucose. And so they're actually raising their glucose. Their liver brings the glucose up to their thermostat level, right? the glucose stat, the thermostat that keeps it at that level all the time. And if your body is wanting it to be at 120 all the time, then you're not going to come down to normal, because you're going to start using whatever resources are available, including protein, to make more sugar so that you can get it up to that 120 mark. And so when people hit that plateau, there's a couple of things to do. One is to measure ketones. And measuring ketones is really simple. The easiest way is to go to any pharmacy and tell them you want keto sticks. Or you can find them. They're easy to find. But if you don't know what you're looking for, then ask them. And they're going to have them. They're for people with diabetes to measure urine ketones. That's their purpose. And the reason they have them there, and just so that you understand the way the system is versus the way we're using these, the system is set up for type 1 diabetics. And if you're injecting insulin and your insulin isn't working, or you have insulin antibodies, or you're not getting enough insulin, then what'll happen is you'll start burning fat. You'll start making ketones, and you have high sugar and high ketones. That's a bad sign. That's not a good thing. And so that's something called diabetic ketoacidosis, and it often requires an intensive care, like an ICU stay in the hospital for a period of time to get things back to normal. So it's kind of important that people with type 1 diabetes have those keto sticks so that they can measure if they're making ketones and they have high sugar. So high sugar, high ketones, bad news. You should have low sugar, high ketones. Low sugar, you're not eating sugar, you're not burning sugar. And so you have ketones because you're burning fat for energy. So that's the way it should be. Or, to people with type 1 diabetes are often the other way around, no ketones and high sugar. But if they have both, then that's not good. But we want you to have ketones, high ketones, and low glucose, right? Low sugar. So that's what it's supposed to be, and that's why we use it, and that's what it's good for. Now, you can also, if you want to be really I want an accurate number here, then you can get a finger stick ketone meter. And you don't need a prescription. You can go to any, I found not every pharmacy has them, but a lot of pharmacies do carry them. I got one from Walmart, I think.
I have one. It's it's actually called Keto Moho. Got it off of Amazon.
Okay. Keto Mojo. Is it a ketone meter?
For ketones, yes.
And it's a finger stick, right? You put blood on it.
Yep.
Yeah.
You prick your finger, and then you put the test strip, which I don't have, into this, and it'll read it for you and measure your ketones.
Yeah. So the one I got has both glucose and ketones. So you prick your finger and you put the blood spot on the ketone meter, and they'll tell you how many ketones, and you pull that one out and put a test strip in for sugar, glucose, and then it'll tell you your glucose in your blood too. You put another drop of blood on that. And that worked really well, because what do you want to know? Well, you want to see the high ketones, low glucose, right? That's what you want. And the reason they make those is the same reason. If someone who's diabetic is, their blood sugar is 500 and their ketones are over 1, then there's a problem there and they need to go to the hospital. But the other way around, that's a good thing. That's actually really healthy. So you can have a blood ketone meter, but there's also a breathalyzer ketone meter where you can breathe into it. And what's really interesting about that is each one of them is measuring a different ketone. We have a lot of different ketones. So one is acetone, which comes out in your breath, and people can smell that. And so when you're in ketosis, you often, people say, oh, you have bad breath, and it's ketone breath, and it's usually like sweet smelling. And I don't know, some people, maybe it bothers them. And then in the urine, the beta hydroxybutyric acid comes out in the urine. And then the one in the blood, no, the one in the blood is beta hydroxybutyric. The one in the urine. Anyway, I don't remember which one. There's another one that comes out in the urine. And they're all ketones, and they're all made by the liver so that you can have energy to your brain and other tissues that require energy. And it's really good to run on ketones. It's really good for you. When children who were children who had seizure disorders, and these are little babies who are having seizures like 20 times a day, and they don't know what to do with them. Since they were having seizures 20 times a day, oftentimes they wouldn't eat, and so they would stop having seizures when they were fasting. But children can't fast forever. They've got to eat sometime because they've got to get. And as soon as they started eating again, they'd start having seizures again. So a brilliant pediatrician at Johns Hopkins Medical Center 100 years ago said, "Oh, what if we trick the body into thinking it's fasting by taking away all the glucose out of the diet and just giving them fat to eat, so that they're always making ketones?" And that tricks the body into thinking you're fasting because you're not making any insulin. And it worked. And so these children were put on, they would fast first until they stopped having seizures, and then they would put them back, start eating a ketogenic diet after that, which was a very high fat diet. And this wasn't like our phase 1 of the program. This is like you have to eat 100 grams or more of fat. So you're eating like spoonfuls of coconut oil and butter and just like fat bombs of all kinds. And they did very well. Here's the kicker. They stopped having seizures and didn't have any more seizures. And after 2 to 4 years, they can take them off the ketogenic diet and they'd never have another seizure all their lives. And they can eat anything they want, and they didn't have to be in ketosis. Why not? Because it repaired the brain. It fixed the brain. Now, take medications. If you give somebody Dilantin and it stops them from having seizures, the rest of their lives, they have to stay on Dilantin. If they go off Dilantin, they're going to have seizures. The seizures are going to come back. The Dilantin only gives you hours of relief. That's it. It doesn't fix anything at all, whereas the ketogenic diet did. Why is that important? Because when you're in ketosis, you're repairing things in your body, and not just your brain, your kidneys too, and your liver. So it's an important part of the phase 1 of the program is to get into ketosis, so you get that repair process and get your thermostat, your glucose thermostat down from wherever it was, 200, 150, 120. It needs to be between 70 and 90. That's the optimum place to be so that you don't get brain problems and kidney problems and liver problems and eyeball problems. So measuring ketones, that's good.
Yeah, this is really good. Ask your questions in the Q&A. We'd love to help answer anything. Well, Dr. Saunders would love to answer those questions for you. Actually, I'm going to share this. I'm just curious if this is what your thoughts are on this here. Ideal levels for ketones. How does that look?
Yeah, blood ketones, millimolar. Oh, that's interesting. 15, 20. Yeah, 1.0. Yeah, 1.5, 2.0. That's pretty much as high as I got when I did phase 1 of the program.
Okay.
And I was doing the under 20, and I was staying pretty close to 20 because I like carbohydrates.
Yeah.
So I was eating nuts and I was looking at, okay, how many carbs does this have? How many carbs? I want some jicama. Okay, 4 grams and a half a cup. Okay, I'm good with that. So yeah, I was pretty much staying between 1 and 2. I never got up to 2.5 or 3.
Okay. Interesting. All right. Okay, let's hear your questions.
Cheryl, you were measuring ketones. How did you do on it?
I have actually not used this yet.
Oh, okay.
I bought it with the intent of using it, and then I was using ketone strips.
Oh yeah.
The urine ones, and I was at 1.5, the same.
Okay.
Yeah.
Right. Let's see here. A couple things. Nobody is on video right now, and except for us, so we'll just leave it like that for today, just so that you guys are aware. I know there were a couple questions about that. And I'm also going to know Elliot is in Michigan. Says it's 48 degrees there. Elliot, I'm plus 70 today in South Dakota. I just want you to know that because I know we were both in cold places. I think it was chilly for both of us last week, so there's hope. Okay. Let's see here. Anything else over there? All right, I'm gonna jump over to the Q&A. That's where I'd love for you guys to post your questions, okay? So this isn't specific about ketones, but Anonymous said, I heard about sugar 6 drops by Dr. Bruce Helbert. Is this legit or is it a scam? Or maybe this has to do with ketones. I guess I don't know. Sugar 6 drops. Are you familiar with that at all?
I don't know a sugar six. It's probably a hexose molecule with a 6 carbon sugar. But I don't know what sugar 6 drops are. I don't know what that is.
I'm not sure either. Actually, yeah, I'm not sure. Okay, next question. Stella says, if you want to swap berberine for metformin, is one berberine tablet equal to 500 milligrams of metformin?
As a matter of fact, yes, they're roughly equal. And berberine is kind of short acting, so it's best to take it 2 or 3 times a day. Twice a day is equivalent to metformin, taking the 500 milligram twice a day. And if you want more effect, it's not necessarily going up to 1,000 milligrams a day. Taking 500 3 times a day is actually probably better.
Okay. Anonymous said, I thought if I happened to have higher carb or sugar, it was recommended to have protein to help hold down a blood sugar spike. Last week, I thought you said not to have protein. Can you explain?
Yes. Okay. Don't mix protein and sugar. Yes, they say that because they say that if you add anything to sugar, then you decrease the spike, and that's the glycemic index. So the glycemic index is a rapid spike. Glycemic load, though, increases with that because you have less of a spike, but over a longer period of time. And so because of that, you're making more insulin. It's the reason for not eating protein and carbs together. But last time when we were talking about that, we're talking about how to separate them out, because when you eat carbohydrates, you make a hormone in your stomach that suppresses the acid. And when you eat protein, you make a hormone that increases the acid. And so when you have both together, you have something in between. And there are several kinds of protein that need very high acid to be denatured so that they can be cut up into pieces. And the sugar or glucose, if you eat a lot of it with a meal, you prevent the good digestion of your protein. So that's the protein part. The other half of that, what we were talking about last time, was the protein fat. So like meat is fat with protein as a rule. A lot of meats are. And so if you mix fat and carbohydrates, then you get more insulin resistance by like 10 times more. It's a lot more. It's not a small amount. So what mainly we were talking about last time was separating the fat from the protein. But you also do want to separate the carbs from the protein. That's a good idea.
Okay. All right. Anonymous said,
I'm sorry. I said I spoke wrong. Separate the fat from the carbs. So protein and fat should be eaten together. They're actually very good. They're synergistic. They work well together. And then carbs should be eaten separately. That's what I meant.
You know, really, do you think there's ever a time where sugar is supposed to be eaten?
Oh, yeah, when you want to run really fast and you want a carbo load so you can get a lot of energy. Yeah, because it really is quick energy. just like they say.
Well, and maybe, and we probably don't talk enough about distinguishing between like fruit as a sugar and Skittles as a sugar. They are different.
They are different.
So, yeah,
Indeed.
anyway. Okay, let's see. What is our next question here? So, Anonymous said, had heart single bypass 2 months ago, and the regular doctor wanted to put me on Actos in phase
Actos.
1. Thoughts on Actos?
Actos. Is that it? What it is?
Yeah.
Okay. So Actos is for blood sugar, and it tells your body to make more insulin. It causes more insulin resistance. It's not really good. It's really odd to do a single bypass. That's kind of unusual because that's something that isn't really helpful. Usually, if you only have one vessel, they'll do a stent or something like that. But the Actos, I don't know. It's not something that I would recommend because there's a lot of side effects. Yeah, I wouldn't recommend it.
Okay. Jace says my GFR,
Glomerular filtration rate.
okay,
Can you say
is
that
between
3 times fast?
Yeah. Yes. But not right now. Okay. My GFR is between 32 and 40 milliliters per minute. Is that right?
Yeah.
Okay. And it drops when I eat too much protein, like red meat. I take a mixture of amino acids, which helps a lot, but I think going to a keto diet would be adverse. Yes, I have type 2 diabetes. What do you say? Oh, and I'm 80.
Okay. So that GFR means you have low kidney function. So an optimum kidney function is over 60 milliliters per minute, and so under 60 is kidney failure, and this is stage 3 renal insufficiency. And so what happens is the protein isn't causing your glomerular filtration rate to go down. You have to remember that this is an estimated GFR. There's an E in front of it. And that eGFR means they're estimating based on the the size of your body, so your height, weight, and all that, and then how much there is expected to go through, to filter through the kidneys, and so they're making this estimate based on your creatinine, and so creatinine comes from creatine, which is made by muscles, and so when you have more muscles, you're making more creatinine, and then your creatinine goes up, and then your GFR goes down, and so that's why that ratio is important. So this is why that having that immediate number and saying, oh yeah, if I'm eating more protein, my glomerular filtration rate goes down. Well, in that estimate, it's not really going down. It's staying the same. It's just that you're making more creatinine, so it appears like it's going down. So the question is, do you need protein? Yes, you need protein. So being on a ketogenic diet is just fine. In fact, it's really good for the kidneys because the kidney cells work better on ketones as well. And you can repair somewhat the kidney function by doing that. So the answer to your question is, could you go on a ketogenic diet, right? And the answer would be yes.
Okay, someone had just asked if all of these are recorded. Yes, they are. I posted in the chat a link for the YouTube video for today, and you can go back and watch all 200 and whatever I said, 87 or 78. What is it now? I forgot. I'm gonna look. Okay, hold on one second here.
That sounds like a lot.
287.
287, yeah. That sounds like a lot, but when you think about it, my son got into some, I don't know what it was, some show that has like 1,000 episodes, and he watched all of them. It was an anime show. I don't know which one it was, but you know,
I was gonna say, was it Grey's Anatomy? Seems like they
No.
probably have that many.
No, he binge watched the whole thing.
Yeah.
Some people do. They watch that many.
Watch our YouTube channel.
Yes. You're going to get a great education if you watch our YouTube channel. So highly recommend. Okay. Next question, Randy says, can metformin damage nerves, or is it actually the metformin taking your vitamin B complexes out of your system?
Um, no, it's the way it works by inhibiting the ability to regenerate your ATP. And that's really what happens. So think about it this way, that everything that is life is about energy. If you don't have energy, you don't have life. And ATP, adenosine triphosphate, that's ATP has 3 phosphates attached to it, is our currency for energy. That's what the cells use for energy. If you have ADP, is the diphosphate, you have 2 of them, then it's less energy. And if you have AMP, adenosine monophosphate, there's only 1 phosphate on there, and that's really low energy. And so the metformin increases the amount of AMP by decreasing the amount of ADP and ATP. So that's kind of forcing the body to use fat for energy and go to other ways of making energy. Well, some people don't go another way very easily, and they actually lose the ability to make energy, and the nerves are especially sensitive to that. So I've kind of given you an overview of how the biochemistry works for metformin. And that's why there was another fenformin that was many years ago, like 30 years ago, 40 years ago, that they had to take off the market because it was so potent that it was killing people, that people were getting rhabdomyolysis. Their muscles were breaking down and they were dying from it. So, it's not, it's okay because it's like a mild toxin that tells the body, you should start making more energy, and so that's why it's used, because it does lower blood sugar. It does help the body to use fat for energy. On the other hand, it can have those side effects in some people.
Stella says, I'm on my 3rd day of a water fast. I've lost 6 pounds and my blood glucose is in the 60s starting last night. Should I be concerned about this? I feel fine.
No, that's wonderful. When you're fasting and your blood sugar drops into the 60s, that's great. And what you're doing then is your brain is making more glucose transport proteins. Your kidneys are making more glucose transport protein. All your nerves are going to work better because they're going to have a better supply, better energy supply. So again, it's energy, right? And having that low blood glucose is what tells your body, oh no, I better make some more of those glucose transport proteins.
So somebody had commented, that was a boatload of information, Dr. Saunders.
I'm sorry.
No, they were like, no, they said thank you. They were appreciative
Okay.
of it.
Okay.
It's great. No, that's great. I love it. More information, better.
I was going to say, when I go to a doctor, they don't give this kind of information at
Yeah.
all. Not anything like this depth.
Yes. It's awesome. It's great.
Here's a medication for you. You have high blood pressure, high blood sugar. Here's a pill.
Yep.
Yeah. The funny thing is, it's because they don't know, and that we weren't taught this in medical school. All of this stuff I've learned since medical school by having patients that need help, and I'm going, I don't know how to help you. Let's start looking. Like last week, I had somebody with chronic fatigue, pain, and has been through, this and this and this and this, and I had no clue what was going on. And she said, could it be mold toxicity? And like, I suppose it could. So we did the test, came back last week. She's got like mold toxicity, like, wow, like I've never seen numbers that high. And so I had to read a whole book on mold toxicity. I'm in the middle of it now, and I've got 3 other books in the wings waiting to learn more about mold toxicity, because you know what? It's a thing. And I probably run across a lot of cases where I've told people, I don't know how to help you, and it was mold and I didn't look.
Wow, interesting. What are some symptoms typically of that?
Fatigue is big. Any neurological problem, nervous system problems, even like mononeuropathies, like somebody gets, you've ever seen Bell's palsy? That could be that's a sign of mold too.
Hmm.
Or sciatica is a sign of mold. That's just one nerve palsy, right? Fatigue is very common with that because it's energy problems. And then autonomic nervous system dysfunction. And you know what? I've had a lot of people with autonomic nervous system dysfunction, and I've been pulling my hair out going, why do you have this? And I don't get it, why it's happening. And in this particular person, it was sudden. It's like, she's fine, she's fine, she's fine. And then boom, it hit. And it was like, there's got to be a reason for that. That's not like a gradual, I'm getting worse over time. No, this was just like, boom. So
Has she found mold in her home, or what is it coming from?
no, we don't know yet. We've just sent it because we just got the test back. So I sent in some tests for her parents to test. She's only 26 years old, still living at home. So we're gonna test her parents now, and then she's seeing a mold specialist yesterday. I think she saw the mold specialist. And then we're going to get back together and work out a plan.
Cool. Wow. That's amazing. I'm glad you dug into that.
We should have a webinar on it, because a lot of like natural health people I follow talk about mold toxicity these days a ton. And you should write a home cures article about it. But
Okay.
Yeah, that would be good.
Okay. I'll do that.
Awesome.
All right.
Sib says, and this is why I try to never miss one of your sessions, even while I'm traveling. Thank you so much.
Oh, thank you. That's awesome.
Love it. That's awesome. Thank you. Sib also had said, if one is going in for their annual lab tests, would you suggest getting off all of their daily natural vitamin supplements before the lab tests? If yes, how long prior to the lab tests?
Well, it depends on which tests you're doing. So if you have something like, if they're measuring vitamin B12 and folic acid, which I usually measure, then sometimes you want to go off of them to see what your level is going to be, instead of just measuring the pill that you took today, kind of thing. But you're going to be fasting while you do it. So, the pill from yesterday, I don't know. If you're measuring calcium, magnesium, go off of those. It's helpful to see where your levels are when you don't take them. So in those cases, if you're looking at those levels, then it's a good idea to go off the supplements. Otherwise, it doesn't really matter that much, because if you're taking the supplements and you want to be on them, and you're taking, like, let's say you're taking Synachroma, and you want to know what your blood sugar is while you're on the Synachroma. So that's not a problem at all. You don't have to stop those kinds of things. It's just the specific, if you're taking the thing that you're measuring, then, it's like, so what? There's a company in, anyway, this company sells a pill. Well, it's actually a pack of pills, but one of them is a beta carotene. So it has beta carotene capsule, right? And then they have a measuring device. It's you put your hand in the device, and it tells you how much beta carotene you have in your skin. And so this company says, we can tell if you're taking your pills or not. But you know what I found that would be very useful if you're not taking the pill and you're eating food that has a lot of carotenoids in it. And so you do the measurement in your skin, the skin measurement carotenoids, and you find that they're really high. That means that's coming from your food. And I think there's a lot more value in that than taking a pill and then measuring that you took your pill. that's like,
Yeah.
so what?
Yeah. I love this. Jay says, I'm an environmental chemist. Mold is a huge toxicity concern, often dismissed. Also, dust containing rodent and bird droppings contaminated with microorganisms.
Yeah, yeah, yeah. Hantavirus. Yeah, there's virus, but not just that. I mean, that's a bad one because people die from it. But there's a lot of other things, that droppings from animals and things like that that contain viruses and bacteria. Yeah.
Barbara had said, I was offered Actos by two MDs. One side effect is bladder cancer. Why would a doctor want their patient to take it?
Because that's what they have. So you have tools, and you say, this is what I have in this box, and so I can choose this one or this one or this one. Oh, why don't we choose this one? Because it's been around a long time, and I've had a lot of experience with it. Um, I agree. I agree. I don't think it's a proper way to do things. But then, by the same token, I don't think that taking a supplement, like people take hawthorn berry extracts to lower their blood pressure, and I'm like, okay, that's fine, but that doesn't deal with why your blood pressure is high necessarily. So if you have kidney failure, kidney problems, then you want to know that and fix that, and not just take some herb. So whether it's a vitamin or an herb or a drug, whatever, it has the same issue, and that is, first deal with why you have it.
Okay. Maurice says, I'm taking
Bisoprolol.
okay, fumarate, and atorvastatin, and have stopped taking metformin. I started synochroma. Will there be some bad effects from this?
Well, maybe, but the body is very resilient, that we can tolerate a ton of toxicity. And talking about mold toxicity, as I'm reading books and stuff, one of the reasons it's brushed aside is because 80% of people, they clear out mold toxins no problem. It's just the 20% that don't clear out the mold toxins that start getting all these weird symptoms. And they're not really weird. They're just different than the classic, the toxicity, right, of something else that has a specific symptom. And because mold doesn't have a specific symptom, well, the fact that 80% of people clear it means that there's no problem, right? No, that 20% of people are going to have a problem with it. And so you have to deal with those 20% that are having a problem.
All right. Jay says, thank you. What you are saying generally, okay, what you are saying generally comports what I learned in my biochem courses long ago. However, I did learn to be aware or beware of acidoketogenesis. So to eat carbs regularly.
Yeah.
My wife has been diagnosed with fatty liver. She had her gallbladder removed a few years ago and is now on a ketogenic diet. She hopes she's doing the right thing. Any suggestions for her?
Oh, no, that's actually not a bad idea, because when you're training your body to burn fat, then you're going to take the fat out of the liver. And if you're not doing any damage to the liver, so you're not drinking alcohol, you're not eating fructose. Fructose is the super sweet sugar. That's what makes fruit really sweet. That's what makes sucrose really sweet. That's what makes high fructose corn syrup so good. And so that's where fatty liver comes from. The two biggest offenders are alcohol and fructose. So if you're on a ketogenic diet, you're not going to be eating fructose, right? So, and you're not going to be drinking alcohol either. So I think that's a good idea. And you're training your body to burn fat, so you'll be taking the fat out of the liver. I think it's a good idea.
Okay. Randy had mentioned that another supplement that was for glucose. It says an online review of glucose remedy supplements picked Glucose MD as the best and downgraded Synachroma because of the magnesium stearate filler used in its production. Is there a significant reason for the use of magnesium stearate?
Yes. Okay. Stearic acid is a fatty acid. Um, uh, uh, these are two things that are actually good for your body. Stearic acid, fatty acid that your body uses for energy, and then magnesium, which is a common deficiency. But that's not why they use magnesium stearate. Somebody said, "Oh, magnesium stearate, that's a chemical that must not be good for you." Well, it's a fatty acid. We use it for energy. You make it in your body. You make your own stearic acid. The purpose for the magnesium stearate is to make the machine works smoothly, so everything works smoothly. So yes, it's a filler, and it's used for the purpose of making the capsules. But no, there's not an issue with it.
Okay. Cool. Haven't heard that question before. So, Anonymous said, how safe is sometimes I make up words when I look at things. Prostatatic arterial embolization, PAE, for BPH safe?
Okay, safe. Well, in the right hands, it's somebody who's had a lot of experience with it. What they're doing is clotting off a blood vessel, clotting off an artery to stop the blood flow so that you get necrosis and die. That part of the prostate gets necrosis and dies. So in a way, it's safe. In another way, it's still an embolization, and it will affect. Well, it'll affect your prostate and all of the tissues around it as well, to some extent. But when done properly, it works pretty well, and it's another option.
All right, here is a message from Rosalind. Hi, Dr. Saunders. First, let me say I really appreciate your advice. When things health-wise for me are not right, I can hear your voice saying, if you keep eating wait, you should read this part. No, I'm just kidding. If you keep eating like that, you're going to start having problems. Anyway, cholesterol has gotten out of control. I kept asking my doctor, where is my kidney level, cholesterol, my blood sugar? I would get a vague answer and told you're okay. It just didn't register inside me. I went to my natural doctor who does all kinds of tests. He conducted one that showed everything in the yellow. He said last year it was green, now it's in the yellow. Long story short, we were able to turn things around. My cholesterol went from 290 to 184, triglycerides 132 to 78, LDL 210 to 115. I've still got some work to do on my sugar. I'm still in the sevens, but I believe is doing some stress eating because I have to move unexpectedly. Frustrating. Taking insulin seems to cause an allergic reaction. I don't care how much they change it. Why is this? I'm either itching or hurting. Any recommendations?
Oh, well, first of all, find out if you need insulin first, because if you do your C-peptide level and it's normal, you probably don't need insulin at all. The greatest thing you did was getting the triglycerides down. Being under 100 is great. And the other one, if you look at the mortality for cholesterol, there's an optimum range is right around 230 is the perfect place to be. As you drop your cholesterol lower, the mortality rate goes up. And as you go higher, the mortality rate goes up. So you went from 290, which has a little bit of a mortality rate, not much, to about equal mortality rate on the other side at 180. Sounds like the same. So ideally, you want your cholesterol to be around 230. But the triglycerides, getting them under 100, that is great. So you've really made some good changes. And so find out, you may not need insulin. And if you do a C-peptide level And if your C-peptide is over 1, then, for heaven's sakes, don't take that risk.
Kind of makes you wonder too, sometimes, the body is really intelligent. And so if you're itching after using insulin, it's almost like, body, are you trying to tell me I don't need this? Or, I always have to think about those things when stuff comes up. So it'd be good to get it checked. All right. Anonymous said, how to train body to get past hunger for fasting. Don't have the discipline past my routine.
It's hard. And you know what? When I first started, I had to trick myself, and the trick was that I would just like randomly start. Okay, starting today for the next week, I'm going to be fasting. I'm just going to drink water. I couldn't like work up to it or plan it or anything like that because it's hard. Like I didn't want to do it. Oh, I would dread it for days if I did. So it's just like, okay, starting today, I'm going to be fasting. And it would just come up like, oh, I'm going to be at work all day and I didn't bring my lunch and I don't have lunch. And okay, then I'll just fast for the next 7 days.
Yeah.
That kind of thing. You know what? I do my 3-day fast first weekend of every month. I got that down and I'm okay with that. But I don't know, hunger is hunger, and distraction is a great way to overcome hunger. And just say, oh, gee, I'm really hungry. Acknowledge that you're hungry. Go, gee, I'm really hungry right now. Oh, let's go read a book.
Yeah. I think when I was younger, I would try to fast on the weekends so that I could sleep or lay there and be in my own misery. And the older I get, I need to be distracted. Like if you have a busy work day, it's easier to focus on that. So I would agree that'd be for me too. Okay, Marie says, I'd like to reduce inflammation in my leg. What do you recommend?
Okay, first find out why the inflammation is there, because sometimes inflammation is not inflammation. And often I've had people like go to a doctor and come back and they say, oh yeah, they said I had some itis, some inflammation in my leg and my foot or something like that. And we test it, we measure it, and go, no, that's not an inflammation. It's a nerve problem or it's a blood flow problem. And you can measure inflammation. You can't measure, well, you can now measure blood flow. I have an infrared camera that you can actually see changes in blood flow. But you have to look at it over time, different times. Anyway, so the point being that it may be a blood flow problem, and it may be a problem with the nervous system, and it may not be inflammation at all. So if it is inflammation, then you may find something like turmeric, curcumin, or boswellia are actually as good as naproxen and ibuprofen for lowering inflammation.
Barbara says, will fasting make mold allergy better?
Okay, wow, that's big, and yes or no. Either it's going to make it worse or it's going to make it better. So in most mold toxins are lipid and water soluble, and so they get into the bile acids and they recycle through your body, and so it's really hard to get rid of them because they recycle. While you're fasting, they stop recycling because you don't put out bile, and so you don't. So they go out. So you lose them more easily during the time that you're fasting. However, as you're mobilizing more fat, you're also mobilizing the toxins that are in the fat. So somebody who's mold toxic also is going to have some stored there. And so some people will seem to be getting worse while they're fasting. So there are benefits. Yes, it is a detox. It is real. It does help. But some people who have mold problems may need to take binders. And this is what I'm just finding out in the book I'm reading, that binders are uh, a whole another world of how do you get rid of something. So like cilantro could be a good binder. There's something called cholestyramine, which is a prescription. Fiber generally can be a binder for some of these things. Partly not because they bind to the toxins, but because they bind to the bile acids to help the toxins excrete. So some people, if they're doing a fast and they're detoxing, they may need to take something like cilantro, charcoal, or some kind of fiber binder.
All right, hit the raise your hand button if you want to know the book that Dr. Saunders is reading about mold.
Oh, it's called Toxic by Neil Nathan. Toxic.
Okay.
It's actually the best one I've read so far. The reason is because he gives the toxicity. He doesn't narrowly focus on just the mold toxins. He's saying, look, people that have mold toxins also have problems with Lyme disease or Epstein-Barr virus and other toxins, heavy metals. And so he deals briefly with all the other ones too and says, okay, so you may need to know about this and this and this if you're going to deal with that. And so that's really been helpful. And it's written in a way that for most of it, at least, anyone can read it and anyone can pick it up and go, oh, I can use these binders. And he's really good about explaining, some people, if they use too much, they're going to have problems. You start with just a tiny dose and then build up and stuff like that. So I think it's a good book.
Awesome. Okay, thank you.
Is most mold airborne?
Yeah, most of the mold spores are airborne, and that's where it seems like most toxicity comes from. Okay. It's really weird. I had a patient that was like, this is 10 years ago, extremely mold toxic, to not just having headaches, but hallucinations, and was not able to take care of himself. And they found in the window air conditioner in his bedroom, that has like the water, like it collects water in it from the air conditioner, that it had a ton of mold in there. It was just blowing spores into his room all day and all night. And his wife is in the same room, the same amount of time, same air conditioner, breathing the same air. She has no problems at all. She's perfectly fine, tests negative, and he tests super high. So go figure.
Go figure. We're all a little bit different. Okay, the book was Toxic by... Don't
Neil,
just Toxic. You're going to find a lot of inappropriate books. So I'll just tell you that.
Neil Nathan.
Neil Nathan.
MD, yeah.
Okay. I don't want to forget it here. Cheryl, would you be able to read one of the questions?
I was just going to jump in. There's a question from Claudia. I take a lot of supplements, Synachroma, vitamin D, zinc, CoQ10, magnesium glycinate, lutein zeaxanthin, and fish oil. Is there a drug interaction between supplements? I take no prescribed medications.
Okay, so all the ones you're talking about, the supplements that you're talking about, are food. And so are there drug interactions between supplements? No. Are there supplement interactions? Well, yeah, there can be. So for example, if you're taking amino acids, that some amino acids will compete for absorption with other amino acids. And so you will preferentially get some of them. If you're eating sugar, for example, like sucrose, it decreases the absorption of certain amino acids, so you get other amino acids. So if you've ever had they talk about like people feeling better after eating a turkey dinner, it actually works better if you have some sugar with it. So you have dessert, or you have like cranberry sauce with the turkey or something like that, that's going to add sugar, because it will inhibit the absorption of the arginine, lysine. You'll tend to get more tryptophan, which is made into serotonin, which is made into melatonin, which is probably why people get nice and calm and relaxed after a turkey dinner. So it's not just the turkey. It's actually this drug interaction between the sugar and the turkey. So yes, in a sense, the vitamins could have interactions, but the ones that you're taking shouldn't.
I don't know if you read this, but Claudia did say I'm pre-diabetic 6.0 and I eat well organic. Just some added notes. Okay. Anonymous said, what is max LDL then? Is 115 okay?
LDL should not be even on the test because they don't measure it. It's a calculated number, and it's calculated from the total cholesterol minus the HDL, um, and it's not related to any form of vascular disease or heart disease. There's just no relationship at all. So it's not something you should even look at, LDL. So a better one to look at would be HDL. HDL is actually measured, and it does actually have something to do with vascular disease, heart disease. And it's more of the HDL to total cholesterol and the HDL to triglycerides ratio. Those are the ones that are useful for measuring and that are worth keeping track of, to see what your risk is.
Okay. Thank you so much, Dr. Saunders. Go enjoy that beautiful day, even though I know you got to go back to work,
Gotta
but
go back inside.
I know, I know. Thank you for being here.
Okay,
We'll
bye.
see you next week. I was just going to mention here, Trisha said, I have this book and I've been trained in mold. So, or not Trisha, Tisha said that,
Yeah.
or Tisha. So that's awesome. And if you have any thoughts about that, feel free to share.
Mhm. Come back in a few weeks after Dr. Saunders has written an article. We'll do
Yes.
a webinar on it.
Jay says, from my clients, I've found that those who are or might be immunocompromised are more likely to have severe allergic reactions to specific molds, like Staphylococcus. I'll have to look that one up. Okay, or even Aspergillus as examples. Yep, I don't know what those are, so I'm gonna have to do some more studying. But I love it. I love this. See, I love when you guys get to help us learn here too. It's very fun. Okay, that's it for today. Come back next week, same time, same place. Invite a friend. Cheryl, thank you so much for being here as well.
The lovely Leslie.
Did you guys notice we matched today? We both showed up wearing pink and blue. What
Not
are the
planned.
chances? She's in Florida. I'm in South Dakota. We didn't even know.